My name is Mariana Moles, and I'm a Public Information Officer here with the Emergency Operations Center in Santa Clara County. And I want to thank you for joining us this morning for Live with the County. In just a few moments, we will discuss how case investigation and contact tracing can assist the Public Health Department in containing transmission of COVID-19 here in our county, as many activities and businesses resume operations today, July 13th. Prior to the broadcast, I removed my face covering, and my guests will as well to assist our ASL, American Sign Language interpreters, so they can clearly understand what we are saying. The public is encouraged to keep on their face coverings when conducting essential activity outside of the home. So we want to take a moment before we get started to provide an update from our data dashboard. As of yesterday, our total case count is 6,298, and our total death count is 166. Fortunately, there were no new deaths, but we do express our condolences to those who have lost loved ones to COVID-19. So as many activities and business operations resume today, slowing the spread of COVID-19 and keeping the community safe will continue to be the top priority and will require in case investigations and contact tracing. And today we have Dr. Sarah Rudman, who is the Assistant Health Officer for the Public Health Department, and Gonzalo Riccambeni, say that correctly, to talk about this. And so thanks so much for being here this morning. Welcome. This is a very important topic, and so we have talked about it a few times over the last few months, but we are really gearing up now, doing lots and lots of contact tracing. So thank you for being here. We'll go ahead and get started with questions that we have received from the public and also things that we just want to help you guys understand more about contact tracing and how it's going. So Sarah, I think this is a question for you. For those people who are not familiar with contact tracing and case investigation, would you explain a little bit more about this and why it's so important and the benefits and the functions? And it's kind of like public health bread and butter, right? Mm-hmm. Contact tracing, as Sarah Cody likes to say.
That's exactly right. So contact tracing is a tool we've used in public health for actually decades, if not almost centuries. We use it for a wide range of diseases. And the idea is every time we're aware of a disease that can be passed from person to person, we want to get ahead of those chains of transmission as quickly as possible. And we do that by identifying those people who are sick, in this case because they've tested positive, and making a personal phone call to them to trace back everywhere they've been during the period that they're contagious and could pass the disease to someone else. In the case of COVID, that starts 2 days before they started to experience symptoms. And in people who have never had symptoms, since we know that you can get sick without feeling it, we start from 2 days before you first tested positive. From then right up until the period where you go into isolation to stop passing the disease, we're worried you could have exposed someone else. So our job is to contact everyone who's gotten sick. Our first job is to make sure they know that they've tested positive and have the health care and the resources they need to stay home and keep from passing to someone else and protect their own health. But then we're looking to see who could they have contacted during the time they were contagious, and then reach out to those individuals, the contacts, make sure they know they were exposed, get their questions answered, make sure they have the health care and the resources they need to stay home, and make sure they understand that their staying home right away before they get sick is the most important thing we're going to do to stop chains of transmission. So Gonzalo, do you want to tell us why you're here, why you're an expert in contact tracing, and if there's anything I missed about it?
No, you pretty much have it all. I'm here because I'm a communicable disease investigator. A big part of my job is to do contact tracing. It's how we stop the spread of disease within the community. And it's basically members of the community helping stop the spread of this disease within the community. And it's very important, like Dr. Rudman said, to get ahead of the disease. If we play catch up, the disease is going to just keep spreading, and it's going to be harder and harder to control, and it's going to be harder and harder to keep opening up businesses, livelihoods. So it's very important that we keep the amount of the virus in the community to a low level as possible, and we have enough contact tracers to help stop it from spreading to other people within the community.
Great, thank you.
Thank you. So can you explain a time in the past, or probably going on right now, that public health uses contact tracing for other diseases?
Sure. I usually think of measles as a prime example where fortunately it's very rare in our community now because most people are vaccinated. But whenever we're aware of a measles case, we do that same trace back to see where could they have acquired the illness and then focus on everyone who could have been exposed during the period that they were contagious. In the case of measles, we know a lot more about the infection, we know a lot more about how to stop it, and we have a vaccine that helps to prevent it. And so we gather information about the people exposed to help understand, are they at risk of getting sick, and then give them those same really important instructions about staying home and staying away from anyone else who's at risk of getting ill during the period they might get sick. And we call that request to stay home quarantine, which I know is sort of an intimidating word, but all it means is staying away from anyone at risk of getting ill if you get sick. And it's so important we do it actually before someone gets sick so that at the time they become contagious, before they might even know that they're unwell, they're already protecting their community by already staying home.
Yeah, quarantine is kind of a scary word. I think maybe movies have done a very good job of making that a scary word.
Yep.
But we'll get into more details about how public health makes it a safe, easier process for people. So what is the status of case investigation and contact tracing in our county right now?
So I'm proud to say Santa Clara County has done an amazing job in being able to respond to the need to provide contact tracing on this scale. Again, this is something that usually a small single department within the county, the public health department, does for every disease that can be passed person to person. But given the scale of this pandemic and how many people in Santa Clara County have been affected and are at risk, we have done something amazing and grown from a small team of just one department to over 800 contact tracers in just about 6 weeks.
And that's about almost twice the size of the entire department.
That's double the entire public health department, whose job is responding to every single other disease.
Right.
Yeah.
Yeah, for 2 million people.
Exactly.
And can I just point out that this is why it was so important to do the shelter in place and the sacrifices that the community has made to abide by the shelter in place, to get the cases low enough so that we have enough contact tracers to follow up. And when time is of the essence with this disease, since it spreads so quickly, we need to get to these people as soon as possible. And we couldn't do that without the sacrifices that have been made in the last couple months. And now it's time for us to act and to make sure that the community has this tool available to them to keep those cases low and to help stop the spread.
That is such an important piece, the time element that we needed. It goes hand in hand with the hospitalization, or the hospitals preparing. We're able to prepare for contact tracing as well. So what is the day-to-day expectation of contact tracing volunteers? Can you describe a typical work day and kind of walk us through the process of what they do?
Yeah, so they will be assigned a case, someone that tested positive for COVID-19, and they will call and verify that it's the person that they're speaking to is the correct person by verifying the name and date of birth. And like Dr. Rudman said, we first also have to make sure that they are aware that they tested positive and what that means for them, and to answer any questions about the disease and how to protect themselves and their loved ones, and also members of the community. So they call, they make sure they're speaking to the right person, that they're aware that they tested positive, check up on them, do like a hospital would or a doctor's office would check up after you test positive for something. In this case, we do that just to make sure if the provider hasn't called back, and if there's a lot of cases, they may not get enough time to reach back out to them. So we're there just to make sure that they are aware that they tested positive, check up to make sure that if they're having any symptoms, that it's not a severe enough symptom that they're delaying their access to a hospital to go seek medical attention, and to answer those questions. And then we also ask about who are the close contacts. A lot of the close contacts end up being members of the households. So it's also about making sure that they have access to getting tested or to isolating. And what does it mean to isolate versus quarantine, for example? And I'm sure we'll talk a little bit more about the difference on that. And then we get the information, as much information as we can, and based on the trust and of the person that tested positive, the index case. And we reach back out to the contacts, make sure that they're aware that they may have been exposed to somebody that tested positive, and to offer any resources so they can adequately quarantine. And also, if they want to get tested, make sure we give them resources for where they can go get tested. And if they are experiencing any signs or symptoms, to help with seeking medical attention in certain cases with that as well. We also offer resources for, if they're having trouble getting medicines or food delivered, if they need to stay at home and they can't leave, we also offer help with that. So it's a variety of different reasons why contact tracing is important, and also the data information. Just how often does a person get symptoms? What kind of symptoms are most common with this virus? We're still figuring it out. This is a new virus, a new disease. So we're trying to get as much information as possible. We're learning on the go as well. So it's imperative for us to get this information so we can educate the community, and also base our policies on which communities are most being affected and where do they need most of our help the most.
So it's really a full support system, because if somebody needs groceries delivered, or they need a way to get to their doctor's appointments, or if they don't have a doctor, or maybe they don't, how many languages, for instance, are the contact tracers calling in?
Yeah, we have access to language experts and interpreters to speak every single language spoken in Santa Clara County. And in particular, for our most commonly spoken languages, Spanish, Vietnamese, Mandarin Cantonese, and Tagalog, we have on-site or individually trained contact tracers who are native speakers in those languages, who can call in the contact or in the case's native language.
So this team is really there to support that one person and make sure that anybody else that they exposed is notified as well. We're going to do everything we can to support you. We will even find, if you don't live in a safe environment, we will find a safe place for you to stay while you're in isolation or quarantine. So I know a lot of community members are concerned about privacy. You touched a little bit about what we ask. Can you go in more depth about the privacy piece and also the questions that are being asked? Because we're not asking nearly as many personal questions as a credit card company might ask, for instance.
Yeah, we would never ask anything regarding your finances, any financial questions. We never ask that. We never ask for Social Security, and we never ask about immigration status. We're just focusing on trying to help stop the spread of the virus, and that's what we're going to focus on.
And then the information is not shared with law enforcement. Is that correct?
No, it's
right.
not.
It's protected. It's what is PHI? I always forget what it stands for.
Right, so this protected health information, there are a couple of layers of protection. I think there's first electronic layers of protection. It does go into a protected electronic database that have multiple layers, making sure that data can't be breached. In addition, all of our contact tracers go through extensive privacy training. And there are audits to make sure that that privacy isn't breached, so that the use of this information is only for the protection of individuals' health and the community health and nothing else.
Yeah, and it can be a little, when we interview, it can kind of come off as an interrogation, but just know we're not trying to interrogate you, we're trying to interrogate the virus. And since we can't talk to the virus, we have to go through you, but we won't ever ask anything that, like I said, financial, Social Security, or anything dealing with immigration or law enforcement. That's not what we're doing. And it may sound like an interrogation sometimes if we're asking personal questions regarding your health, but just know that it's voluntary, and if you don't feel comfortable, just let us know, and we'll try to move on to maybe an alternative question that can help us get the answers that we ultimately want regarding the spread of the virus and who may have it.
And I want to make sure this is said a few times throughout the show. What is the number that's going to show up on the caller ID when you call? It's not going to say spam. It's not going to be like some unknown number, because we all know that people today do not pick up their phone if they do not recognize the number, which makes contact tracing all the more tough today.
So we'll do two things to help you know it's us calling. First, we'll send a text message right before we call saying that you're about to receive a call from the California COVID team. Secondly, when you see that call come through, it is a 916 number because the system comes out of the state of California in Sacramento. So you'll see that 916 number show up on the caller ID as California COVID team. Additionally, if we leave you a voicemail, it will be from that same number, and it will give you a callback number that you can try that will tell you it's from the Santa Clara County Public Health Department. And then finally, you can look on our website and see some of this additional information that will help you verify that it's really us calling. And then finally, because we'll never ask any information that could be used to take advantage of you financially the way that spammers might, that's the final way that you'll know that this is a legitimate contact tracing call.
Great. And you guys touched a little bit on the training aspect with the privacy. Can you go more in depth about how the contact tracers are trained?
Mm-hmm. Well, I can talk about that. Since Gonzalo is an expert who's been doing this for a couple of years, he had a bit of a slower training than some of our newest folks. Building a team this big, this quickly has been a challenge and very exciting. And so we're really grateful to our contact tracers for learning as fast as they did. But there is about 2 full weeks of initial training. About a week of it is on the basics of the disease and how contact tracing works so that somebody's ready to answer your questions if they give you a call. Then there are additional pieces on privacy, on how the county systems work, on how to enter the information correctly in the electronic database, and what resources exist for cases and contacts, people who've been exposed, so that we can get everyone the resources they need when we're making that call.
Yeah, I think that may be one of the challenging parts is knowing exactly what resources are out there, especially for someone that's a volunteer that doesn't deal with this on a normal basis like myself. Just knowing just how many resources are available and how much of an effort the county has made to have those resources available so we can do this right and to gain the trust of the community and that we're doing everything we can to do this right and with the least amount of inconvenience as possible.
And one of the things the county is still building and building every day and increasing is the amount of those resources. So there is a new growing team of experts, the COVID support team, who's helping to make sure whatever resources are out there get to the people who need them, and then whatever we don't have gets added as quickly as we can so that we are taking care of everyone experiencing COVID right now.
Great. Before we wrap up, I do want to touch on the business aspect of this. Many, many, many more businesses are opening up today, and we want to emphasize that just because something is open doesn't mean you should just go out there and do it because you're bored, and we know it's really tough and people want to get out, but just continue to be very mindful about how often you are going out, wearing a face covering, keeping your distance, and stay in place as much as possible. But from a business perspective, what does contact tracing look like? Are we going to be shutting down businesses? Are we going to be doing contact tracing within businesses? Let's just talk a little bit about the business piece.
Sure. So we do collect information on where people who are sick work if they've been to work during the period they're contagious. And that's just to help us understand all of the different places there could be an exposure and therefore how to make sure everyone exposed knows about it. If we find that there are businesses where the social distancing guidelines are not being followed and so preventable exposures are happening, we do have regulatory components and special investigations team that focuses on businesses and other important settings where large exposures can happen. So it is possible if a business is not following social distancing guidelines or other preventive health guidelines, and we learn about it in the context of contact tracing, that we would reach out, work with that business to make sure they understand the guidelines. And if we needed to close something for public safety, we would do so. But that's certainly the exception, not the rule. In general, if we learn that someone's been exposed in a workplace, a business, or elsewhere, our primary objective is just to identify the people exposed, make sure they know about it, and make sure they have the care they need.
And just one more thing, are we still looking for contact tracers to volunteer?
So I'll say we have done an amazing job, and by we I mean you, the community, has given so much of your time and expertise that we actually right now have the number of contact tracers we need. There are over 800, and almost half of those are volunteers. The other half are county employees who've been reassigned from their usual work to focus on this most important effort. So right now, while if you're really excited to join us, you can still go to our website and search for I Can Help. There may be additional opportunities, but in general, we have the numbers we need, the force we need. We're just working on making the system better every day.
Great. So just to close up, I think final thoughts from either of you?
I think the most important thing is for people to know to answer the phone call, that we will protect your privacy, we will protect your information, and we're calling to protect your health and the people around you. And so do please answer the phone when you see California COVID team so that we can make sure you have the information you need to stay healthy.
Yeah, and just to reiterate that public health has used contact tracing, like Dr. Rudman said, for many, many, many years. We know it works. It's a very valuable tool, and we're done everything possible to try to make that tool as successful as possible for the community, for everyone here in Santa Clara County. But we can only do so much. It all depends also on how much the community is open to answering the phones and helping us protect those that are at risk for getting the virus. So again, please answer the phone. It's a 916 number, California COVID team. And thank you for the trust you've had on us, for us. And I hope we're able to slow the spread enough so that we can continue to open and continue to have businesses thriving, and which is great for everybody.
Thank you.
So answer the call to protect your community. I know that I have in the past couple of months been answering my phone more and more. I don't let it go to voicemail, and I just answer with, "This is Mariana," instead of saying hello, so they don't record my voice. But so I have been making an effort on my end to do that as well. So thank you for being with us today. For the latest information on COVID-19, did you want to? I'm sorry, I'm getting.
Yeah.
Oh,
so,
I'm sorry. We have an announcement.
So I'm just gonna say in Spanish for my Spanish speakers out there. I'll say it in English first and then in Spanish. The public health is using contact tracing to help stop the spread of COVID-19 in the community, and our job is to help protect those who are at risk of getting the virus. We're going to be calling you from a 916 number. It's going to say California COVID team. That is us. We're not going to ask for any financial information. We're not going to ask about any social security numbers or immigration status. This is only pertaining to the health of the community and stopping the spread of the virus. Now in Spanish. Nosotros en el Departamento de Salud Pública estamos usando este programa de seguimiento de contactos para prevenir la propagación del virus en la comunidad. El número de teléfono nuestro va a empezar con 916 y va a decir California COVID Team. Por favor, si pueden atender el teléfono, estamos tratando de acabar con la propagación de este virus en nuestra comunidad y no lo podemos hacer sin ustedes ayudándonos. Nosotros vamos a ofrecer el servicio y necesitamos a ustedes que atiendan el teléfono y nos ayuden a terminar con este virus, la propagación en la comunidad.
And we never collect.
Y nunca vamos a pedir información financiera o el estatus de inmigración o el número social de seguridad. Nunca vamos a pedir esas cosas, ¿ok? Solo vamos a preguntar cosas sobre la salud y con los contactos que pueden haber estado expuestos a este virus, que pueden matar a la gente, y es bien importante determinar con la propagación de este virus para salvar vidas y salvar negocios y poder volver a algo cerca de lo normal. Gracias.
Thank you.
And just to reiterate, we do have Facebook Live in Spanish on Wednesdays at 11 a.m., I believe. Just had a reminder to announce that. That's why there was some chit-chat over here. So thank you again for your time being here, Dr. Rudman and Gonzala. This has been very informational. For the latest information on COVID-19, please go to our website at sccgov.org/coronavirus and answer the call. That's really our main message. Answer the call. Thank you so much.
Thank you.